I'm Debbie Wike, and I would like to tell you a little bit about my story. I moved to Scotland County about 5 years ago after teaching in Monroe and taught for 20 years in the area in North Carolina. And then my husband became the pastor of First Baptist here in Laurinburg, and so we moved to our new hometown of Laurinburg, and we certainly enjoy it. And in February of this year, I just went to have my normal mammogram that I do every year and got that call back and didn't think much about it because I've had a couple of other callbacks, but then I remembered it was the big 3D, so that gave me a little scare. But I came back and they told me I needed to go see Dr. Parks, that there were some problems. And so I did, and he's a wonderful guy who sat me down and explained everything and told me I needed a lumpectomy. So that sounded pretty easy. And so we had the lumpectomy, and after all the tests came back, I came to see Dr. Sittlinger. And she was the first one to use the word chemotherapy, and that just threw me for a big loop because I wasn't very excited about doing that. But I also have 6 grandchildren, so I want to live a few more years or a whole bunch more years, so I decided I would go ahead and do that. And we started chemotherapy, and that opened a whole new realm of medical for me. And Hope has been my navigator, helping me through this. And she has showed me how to walk into this apartment. I tell you, the first day that I had to walk in and see the big sign that said Scotland Cancer Center, I had to cry for a while. But anyway, we walked in and went through it, started the chemotherapy, and it's a wonderful place if you have to be there. The nurses mean a whole lot to me, and Rita's my nurse that I work with all the time. And we've learned and gotten together just as friends to be able to talk a little bit, and it takes, the first 4 chemos took about 3 or 4 hours each time, but I started the new chemo yesterday, and that's a lot quicker. But I think I need to just go back and talk about the different nurses, because even the doctors, because after Sittlinger told me the situation, then I went to Dr. Helms, and I was still not sold on why I had to do this chemotherapy, and I'll never forget how he sat just right here, and my husband was over there, and he just ignored him, and he sat right here and took me step by step by step and repeated it over and over. And I think he could tell by my eyes when I wasn't following him, and he would stop a minute and say, go back over it, but just right here. Every doctor has been the type of doctor that it's all about you, and I want you to understand what's happening. And so after he told me what I needed to do and the radiation, I realized that right here in Scotland County, it was all here. And we talked to our children who live in Charlotte, and their immediate response was, you need to come to Charlotte. And then I have a daughter who lives near Mayo Clinic in Jacksonville, and her response was just move on down here for a little while and we'll take care of you down here. But as soon as I told them that the Duke doctors come into Scotland County and I live 10 minutes away, all that talk stopped. And they have supported me. My family has supported me through all this. We have a lot of conversations on the telephone. But I love how I can come. Someone always brings me, but I can come in and I see people that I've seen in the community. I love how I can know that I just have 10-minute drive home if I feel nauseated or anything, which I really haven't. But I know I've called the clinic, and Hope immediately calls me back if I leave a message, and the different nurses. But even I wanted to go back to the idea, I'm flip-flopping a little bit, but my first surgery, my nurse in the recovery room is a parishioner at our church. And to open your eyes and see somebody you know and think, okay, I've lived through this surgery. Not that I thought I would die, but you never know. And there she was. And just to be able to, the first word was just to say, Myra, Myra, and immediately have somebody there. And that just, the calmness of people I know are here. And then people I didn't know become friends because they know somebody I know. They're on Facebook and they've seen me there or something like that. It's just very personable, but very professional. And I think that's also a big thing. Everything that's been done here in this community at Scotland is so professional. Nobody talks down to you. Nobody makes you feel that you're not educated enough. They stop. You can ask questions. They've been very honest. This is what's going to happen. And sometimes to the point I'm like, I don't know. Or they have to tell you all that could happen. So far, none of that bad stuff has happened. But I knew my mother had cancer. I knew someday I'd get it. But at 64, it's probably the best time of my life to get it. The children are gone. The grandchildren are here. Nobody really needs me. I'm missing one weekly babysitting job that I promised at Christmas for my daughter, but my other daughter's going to take the babies, and I'll be all right. It's probably the best time of my life to have it, and the best place. Just the whole community, my church family. I have a list of people that I can call, or friends, garden club friends. Could you fix us a meal? Could you take me here? Could you take me to my chemos? And this is the time of the life for me. It's worked. It's not what I picked, but I've decided it's 9 months out of the life. I hope to have another 25 or 30 years.